Good afternoon, ladies and gentlemen who have joined us on this Dr. Fundi channel. My name is Dr. Fundi Lenyati. I'm the host of the channel. Today, we have an interesting program. We have invited one of our previous guests, Dr. Nomthandazo Amanda Dube. She was our guest on the 13th of December last year. We were so wowed by her story of surviving COVID. And on Friday, when the country was commemorating the first patient that was officially confirmed to have COVID-19, it was the 5th of March last year. So on Friday, I couldn't think of anyone of the many people who have survived COVID. I couldn't think of anybody that, would be the right person to just reflect on this COVID, this thief called COVID. This thief that has caused so much loss, that has caused so much grief to so many. So I thought I should invite Dr. Nomthandazo Dube. Now, a little bit about Dr. Nomthandazo Dube. She is a specialist neurosurgeon who obtained her fellowship qualification, as a neurosurgeon from the college, in 2018. All right. So that's just about 3 years ago. So she qualified as a neurosurgeon. Now, when she qualified as a neurosurgeon 3 years ago, she was the first Black woman to be trained and pass the fellowship exams being trained at Medunsa. All right. There were other Black females who got to be neurosurgeons, but she was the first Black woman neurosurgeon to pass those exams trained in Medunsa. At that time, she was the third Black female neurosurgeon from the kingdom of the Zulu. She also was one of only 10 Black female neurosurgeons in South Africa. That was 3 years ago. Obviously, the numbers have grown since then. She trained at George Mukari Academic Hospital, and that's where she is still working, which is an academic environment. So her responsibilities involve, doing operations in theater, but also teaching students. But we'll hear more about that. Now, we spent a lot of time last time going through, her growing up history. We're not going to do that today. I will just summarize some key issues about her. She was born and bred in Imbali Township in Pietermaritzburg. Now, there used to be Mbali 1 and Mbali 2 during the times I was in Durban in the mid to late 80s. I'm not sure if there's Mbali 3 or 4 or 5. She will tell us about that. She's the last born in a family of 3 siblings, 2 girls, 1 boy. Yena, she is the last born, but she does not display any signs of being a last born. We know how a typical last born is, but no, she does not have any of those things. Growing up in Imbali, she had no real medical specialist role models except the GPs in the area. She went to Ikopo, where she attended Little Flower High School and obtained very good education there. And she describes her time there as one of the best years of her life. It was a Catholic school, very strict, obviously, but she appreciates the foundation of education that she got there. It happens to be the same school where the Deputy Public Protector, Advocate Koleka Galeka, went to. The family she comes from believes in hard work. The dad, owned a tire business. And so after school, whenever the holidays and weekends, they had to work in dad's business. So she can change tires, she can do wheel alignment, she can balance wheels, and she doesn't need to call AA to come and change the wheels for her if there's a puncture, you know, or call the guardian angel from First for Women. And one of the values also she got from her family is perseverance, patience, and she's a risk taker. Risk taker. Medicine has always been her first choice career as long as she could remember. Even though in her pursuit of that career, she got disappointed a little bit. She had to take a detour via a BSc route and fell in love with chemistry and biochem and became very strong as a person with an analytical mind. But at the end of that, she still went and joined medicine from second year, where again, having gotten to a mode of being very analytical, she had to learn how to memorize things in second year. But she adjusted well and did well during her undergraduate degree. In second year, she enjoyed cutting cadavers, that is dead bodies. When you're in second year, you do anatomy and physiology. And so you are allocated that cadaver and you operate or you cut that cadaver the whole year, looking to learn about nerves and blood vessels and everything. She enjoyed cutting, those cadavers. And maybe that was preparing her for her current, role. Now, as a neurosurgeon, she boasts that she's got a skull, a real skull that stays in her home lounge so that it can remind her of how to approach a skull just before she does her operations. Now she's got another skull that she's carrying with her. Can you just show our people that skull, Doc? Lovely, lovely. Thank you very much. All right, lovely. All right, so yeah, so she also recalled or shared with us that as she was working at Danie in Pietermaritzburg in her early days as a doctor, she used to assist a doctor that is here in Johannesburg who was already a neurosurgeon. And in one of those situations where she was assisting, she was so fascinated by the beauty of a pulsating brain, and she fell in love with neurosurgery from that day. And now it is her career. She's hooked for life. From a personality point of view, she's described as somebody who's very bubbly, somebody who used to party hard, was a life of a party during her undergrad days at Medunse, as she was transitioning to being an adult. She's always loved to have blonde or ginger colored hair, as you can see, since her days as a junior doctor in Pietermaritzburg. In other media, they've called her kick-ass neurosurgeon. One thing that she admits to is that she is a stubborn person. She's a stubborn person. Once she has made up her mind that I'm going to do this, nothing will change her. She has this never say die attitude. She's not afraid to venture where others haven't gone. And during her training to be a neurosurgeon, she faced lots of abuse, lots of problems from patriarchy, where she was told that neurosurgery is the discipline for men, it's not for women. She will never pass neurosurgery. She was abused, she was shamed, she was undermined by another, neurosurgery registrar who really misrepresented our gender. She nearly dropped out of training as a neurosurgeon because of all of this abuse. But because there was a professor who was, her mentor, Prof. Luhwara, she was talked to staying on course, finishing what she started, and she is now a neurosurgeon. So with that brief introduction, I think it's about time that we then introduce to you this lady. Now, I've got a welcome that I have on this channel that I reserve for certain people. Now, last time she told us that she is Mambuyazi. That is the clan name. You know, she's a Zulu person. She's got a clan name. So she is Mbuyazi, Mbonambi, Mkosana, Ngiba, Kanomagama. Mageza ngobisi, amanzi ekhona. So they like to waste, you know. They use milk instead of milk being eaten, or sorry, drank. There she is, she washes with milk. So, you know, bathi wawela ngaphesheya walamba endleleni waza wadla nkonyana yenkosi. So yeah, I've tried to bonga ke sisi, you know, but welcome to our channel, Mambuyazi. Thank you for giving us a chance to talk to you again.
Thank you so much. And that was a beautiful welcome. Thank you. That's the best welcome ever.
I tried, man. You know, when you have to bonga people, sometimes, you know, you need to practice a lot.
Yes.
So I made a few mistakes there, but at least the thought was good.
No, it was perfect, actually.
All right, lovely, Doc. So let's get into business. You are now a neurosurgeon, qualified neurosurgeon. You've been a neurosurgeon since 2018. Now, I just want you to briefly share with our viewers, what does a neurosurgeon do? You know, there could be a child who is out there watching with their parents, you know, this interview. So I thought before we get to the nitty-gritty of what we are supposed to talk about today, just say at a high level, what does a neurosurgeon do?
Okay, so they call us brain surgeons or the brain doctors, because we play in that space. So we deal with any diseases, any injuries, etc., that involve the brain itself. But what people sometimes don't know is that we also deal with the spine. And sometimes we also deal with what we call peripheral nerves. So the nerves that go to your hands and your legs, sometimes we also venture into that space, but it's a growing field. So like I said, any disease that involves the brain and the spinal cord, we are involved. We are the ones that would operate. So if you have a tumor, if you have blood, etc., that needs to be removed, we are the ones that you'll come
in the brain,
in the brain or in the spinal cord. Okay. Yes. Myself, because I'm still in an academic institution, together with having to do the operations, etc., I'm also involved in training. So like you correctly said, I trained at Dr. George Mukhari Academic Hospital and Sifako Makgato Health Sciences University, which is the former Medunsa. So as part of my contract, I have to then help train the medical students as well as our registrars. And registrars are the doctors that have now come into the institution and are going to become neurosurgeons. So we are involved in their training as well, but as well as providing neurosurgical care. So as well as caring for patients, as well as operating.
So you are multiplying yourself to produce more neurosurgeons and to entice the medical students to follow your discipline once they have qualified.
Absolutely. And I must say, so from what you had said earlier, when I was training, I was alone. You know, I think I shared the last time that there was another lady that had joined, but she eventually left, and I ended up finishing training by myself. So for a while, I was the only female neurosurgeon in the institution and in the department. And the one thing that I've fought for since my training and after my training is I've always fought for having more female neurosurgeons, because there are a few of us, you know, and it is such it's a beautiful specialty, if I can put it in those terms. And I've always wanted to have other females in the, you know, in the field, and you know, it just would be nice to have other ladies to chat with, you know, not talk about soccer every day and, you know, those types of things. But so that's one of the things that I really fought for. So shortly before I was admitted, actually three ladies, my apologies, joined the department. And while I was on leave, another lady joined the department. So I'm happy to say we now have 4 ladies that have joined, that are currently training in neurosurgery in our department. And in the various other departments in the country, there are other ladies that are training. So we are definitely multiplying.
All right. So you are changing that space that used to be very much male dominated, the space that was rejecting you, you know, as being female, a space where you can't really wear your favorite high heels.
Yes, we still try now and again. When the opportunity presents itself, we will wear our high heels.
Okay, lovely, lovely. All right. Now, Doc, I invited one of your friends who is an occupational therapist to just come in and share with our viewers the mental and physical demands of your job. I think it's important to just share that information so that when we talk about the ordeal that you went through after you contracted COVID, the things you couldn't do after, you know, you came out of the ICU, then people will appreciate what it has taken for you to move from that point to a point where now you are actually back at work. So I'm going to ask Ms. Ritabile Matolweni, who is an occupational therapist. She's a friend of mine. You know, she's very passionate about matters of disability and incapacity. So I'm going to ask her to just briefly, this is a cameo role, Ritabile. This is not your show today. So please, can you just share with us the mental and physical demands of somebody who is a neurosurgeon?
Thank you, Belle. Good evening, good afternoon, and good afternoon to Dr. Dube, who's also a friend to me. I think there'll be general roles, and also there'll be specific roles to the patient, or who is then a Dr. Nomthandazo Dube. So for instance, Dr. Nomthandazo is mentioning that she's within an academic institution. So she does not only just operate on the brain and the spinal cord, but she teaches, and also one academic institution is going to be different from another based on the number of beds and the staffing and so on and so forth. So if for instance, I were to do a quick work analysis on Nomthandazo, having trained in Medunsa myself, knowing the demands in terms of beds and patient volumes, and the fact that her unit actually admits patients as far from other provinces as Northwest or Limpopo for that matter. So you would not then want to make a general assumption of what neurosurgeons do, but specifically the environment in which Nomthandazo finds herself in. And that's very critical then, because when she went through what she went through when she got infected with COVID, then one must appreciate her work demands and align her rehabilitation needs to what is her actual work environment. And would say that, let me call you Belle because I call you Belle, if you don't mind. So I thought you were laying the foundation.
Yeah.
So Belle, in Nomthandazo's case, would have what you call the physical demands of her work. And then the physical demands, very critical. There'll be a lot, but you then must be able to understand what is essential. So I stand 8 hours, or she stands 10 hours, but is standing essential for a person who's a neurosurgeon? Would she be able to approach the bed and the surgical table while seated on a chair? Does that make sense?
Yes.
Or is the hand function the most critical component in the cognitive function? So there's a lot of physical functions, but I would like us to zoom in on those that are essential in her performing her duty as a brain surgeon. And for me, it is the cognitive or the mental function and the hand functions. We know the hand, you know the hand doesn't start in the hand starts in the shoulder, scapula, the shoulder, because some of the muscles that actually go to the hand, which are the extrinsic bigger muscles, are coming from there. And then we've got the intrinsic muscles, which starts and finishes within the hand. So they will originate and attach within the joints of the hand. And also there's the neurological component in hand functioning, which would also then, we know the nerves that supply the hand, they will start from the neck area, we'll call them the cervical branches of nerves, starting from C1 to C8. So when you have that understanding of then what would be the normal functioning of the hand. Now, for someone who is a surgeon, we need what we call fine motor skills and fine finger dexterity, and what you call, even before we get that, motor planning. Motor planning is nothing but if I want to lift a 5-liter bottle versus what if I want to lift a small pencil, which muscles do I use and what force and what is the precision, so that then I don't have what you call clumsy movements. And of course you need that, because unfortunately, if Nomthandazo drops the ball, a person literally dies or something, or they can be profoundly incapacitated. So you start with things like motor planning, the ability of the brain or the centers in the brain and the muscle to work in a coordinated function or fashion, such that we know which muscles to deploy where and how and in what intensity. And also we'll have what we call fine motor skills and fine finger dexterity, where then you're able to say, I'm lifting the index finger now, which is my second digit, versus I'm lifting the small finger. The small finer grips, the 2-point pinches, what you call the functional grasps of the hand. So those form part of the fine motor skills and the fine motor activities. And those then could either, if for instance, I know Nomthandazo said, I think it was from her first ICU recovery, she sent me a text and says, Mhlobo, I'm worried. I may not then be able to operate, or I'm not even sure. So she was worried if she'll ever be able to operate, and the when part. And then my logical question was, what is wrong? And she says, I don't think I'm able to use my hand, and I don't think I'll be able to operate on a patient. And then, so my mind had to quickly rush back to say that, is it because of a peripheral issue? She was in ICU for a long time. The muscles could have been wasted. So she could just be having a weak muscle, which could then easily be rehabilitated. Or is it a central nervous issue? Is it the centers that actually control the coordination of these muscles at a central part, knowing that there's information which is coming through, which actually links the virus itself to some neurological disorders as well. What is critical is doing a thorough work assessment specific for Nomthandazo to say, how do you operate? What tools do you operate? And therefore link that back to the actual physical component and the level of impairment. And we must also appreciate that functioning is actually working within a context of how are we feeling in terms of our mental state. So the anxieties, the stress, and everything else actually contribute in a person's ability to be able to discharge their roles either in therapy or when they've been discharged. So with Nomthandazo, I saw that it was actually a combination of a lot of factors, and a good therapist, even though I was not part of the treating team that was treating her, but I could almost sense that there's cognitive, there's mental issues which are actually affecting her ability to function.
Yes.
Can I pause there, Dr. Nyat?
I think you can pause. You've given us a good picture. Because I think it was important for you to do this, because we are now going to go into, her ordeal. which
Yes.
is what we are here to reflect on.
Yes.
All right. But for one to appreciate that, one needs to appreciate what, the demands are of her job on a day-to-day basis. So
Yes.
thank you very much, Mamtolo. You can now park there. Please don't disappear.
I won't.
Okay, right. Let me call back Dr. Dube. All right. So, Doc, now, okay. Then we were in 2020, January 2020, that is last year. All of us were very excited. Year 2020, little did we know that this 2020 is going to bring plenty of trouble for all of us. Now, can you just give us a sense of when that year started, which is 2020, what was top of mind for you in terms of the things you wanted to achieve? Because this was before COVID came to our shores. It was still in China. It hadn't even gone to Europe at the time. And we were obviously, like everybody, making our annual, plans and all of that. So what was high level for you, things you wanted to achieve?
Okay, so yes, 2020, I had plenty of plans for that year. I think top of the list was I had just dipped my toe into private practice, and I was planning to grow my practice, to now start functioning in that space and see what that would bring me. I, wanted to grow academically. I had been writing a paper with someone, and we were getting ready to send the paper for publication. Like I said, I had been on Prof's neck about Prof. Ladies.
Yeah.
At the time, I had been planning to join the trauma unit so that I could become so we could contribute in the for neurotrauma.
Yes.
So I wanted to play a more active role in our trauma unit. So there was plenty, that I was getting to do, that I was preparing to do for the year 2020.
Yes, and you were looking forward, you were fired up, and you really wanted to make a difference.
Absolutely,
right?
Absolutely.
All right. So when you first heard about this pandemic, starting in China and then spreading into Europe, when we started seeing those pictures from Italy, what was going through your head?
So I think for all of us initially, we had a little bit of fear, but it was also very far removed from us. Like you're saying, it was in China, it was in Europe. We were not sure, is it going to come, onto the African soil? And if it does, what will happen? But I think the biggest thing was fear, knowing our healthcare system, knowing our own countries, we are not first world countries. And if they were struggling, especially, when Italy, when the devastation started in Italy, that for me was, the beginning of, wow, if this comes to Africa, I'm not sure what's going to happen.
Yeah. All right. But anyway, there was an element of denial.
Yes.
All of us, now it won't get here. Or if it gets here, maybe it will have lost steam, It won't be as bad. But yeah, 5th of March last year, we had our first case. All right. So when you heard about that first case, what went through your mind?
I remember the first thing. So on my page, on the Dube Neuro page, I remember on that day, if I'm not mistaken, either that day or the day after, I actually posted, "Do not panic," because I think most of us went into a complete tailspin and we completely panicked because you'd seen the deaths overseas, and I think the first thing that we thought of was COVID is here, we're gonna die.
Yeah.
So for me, it was like, okay, COVID is here. We need to keep calm. We need to keep our heads, and we just need to follow. So in my mind, it was always, we need to follow the guidelines.
Yes.
So that this is the guidelines that have been put forth by the World Health Organization. So this is what we need to do. So I think, like I said, the first thing I said was, do not panic. And I think I also put up the guidelines that we had at the time from the World Health Organization, because I always believe that we need to follow the science, and we need to follow those that are more experienced than we are.
Exactly, exactly. All right. So you did the right thing. You were getting people to be calm, but you are a human being.
Yes,
We all don't want to die. All right.
yes,
When you are alone there at night, or sitting, you do think about, will I get affected, or what? So you must have done your own personal risk assessment
yes,
based on your occupation. All right.
yes.
What is the likelihood of me getting infected, based on the type of work that I do? Now, as you are doing that personal, risk assessment from a COVID point of view, what are the things that you considered?
Okay, so as you rightly said, because of my occupation, I always thought I'll probably get it. I'll probably get exposed to it. At the time, I always thought because I'm going to be working in a hospital and we will probably have COVID cases, chances of me coming into contact with COVID are very high. So I am likely to get it. But
Yeah.
in my mind, because of I'm relatively young, I have no comorbidities, I've taken all the precautions. Even if I do get it, I'm
There
hoping
are
that I'm going to get it.
PPEs, there are
Yes,
PPEs,
yes.
that you yeah.
Absolutely. So if I always thought if I do get it, I'm hoping that I'll get mild symptoms because I don't meet the criteria for people that are getting, the severe symptoms. Like I said, I'm relatively young. I don't have any comorbidities. I try to eat healthy, etc.
Yeah.
So I thought, okay, should I get it, I'll be able to, beat this thing. But it was always but I hope that I don't get it. I
Yeah.
hope that I'm taking enough precautions for me to not get it at all.
Now, when one looked at your interests, as a neurosurgeon, one of the things I picked up was that neurotrauma, it's an area of your interest. Others like pediatric surgery and all of that. But neurotrauma, last time you told us that it actually presents risks in the South African context, especially on weekends when people have had a lot to drink and all of those things, but basically neurotrauma. So can you just tell us a little bit the risk that is, that is part of that type of work within your basket of things that you do?
Okay, so trauma, whether neurotrauma or just general or trauma, as a whole. So one of the risks that you have is that, you have patients that are coming in. In our context, you more often than not, you have a patient that's coming in that's been picked up from the scene. The patient is unconscious, so you don't have a history at all. You don't know if this patient has been exposed. In the case of a patient that has maybe had a little bit too many drinks, you don't know what the behavior was. Why they protecting themselves, how much exposure have they had. So this is a patient that usually cannot tell you, that cannot give you how much risk they are or how much risk they present to you. So you are always at a risk of being exposed because you
Yes.
don't know what the risk is.
Yes.
So yes. And
And
also the patient is critical,
yes.
This is a patient that you're rushing to theater. So you have to take your precautions and take the patient to theater. So more often than not, you're taking a patient to theater whose status you don't know.
Yes, you don't have the luxury of taking, the test, and waiting for the results. It's a matter of life and death, and you have to risk your life, assuming and hoping that that person, is not infected, or at least even if they are infected, you will protect yourself.
Yes. I mean, you don't have the luxury, more often than not, you don't have the luxury of relatives that can tell you because the patient was picked up off the side of the road, for example. So it's a risk that you're taking.
Yeah. All right. So that's one area of risk which made you to believe that it is likely that you will get this thing, but you were hoping that it will be something that is mild. Certainly nothing that would land you in hospital.
No.
Okay. So one silly day, you started experiencing symptoms that you initially thought were flu symptoms. Just tell us a little bit about that and how that progressed within a short space of time to something serious.
Okay, so I woke up, it was a Monday morning. I woke up and I was unusually tired, and I had a headache. But I thought I've been working very hard over the past couple of weeks. I'm probably tired from that. But I just had this persistent headache, and I went to work. And when I got to work, I had walked up one flight of stairs, and I was just completely out of breath when I got to the top of the stairs. And I remember thinking, my goodness, I need to go back to the gym because this is very bad. I'm really unfit,
Yeah.
And I did the ward round, but it was, one of those where I was just dragging myself because I was really tired. And I went to a friend's consulting room and I said to her, I'm very tired and I have this headache and I'm just not feeling like myself. If this persists, I think perhaps I should test for COVID just to be on the safe side. But I think I'm just coming down with the flu. And we then did the swab. And the following morning, that's when the lab phoned me and they told me that you've tested positive for COVID.
Yeah.
But in my mind, when I was given the diagnosis, I was just like, okay, that's fine. I'm COVID positive. That means I'm going to be in bed in the house for 10 days. Immediately, I called my boss, ordered medication, called the people that I had been exposed to because I had operated the Saturday. So, alerted everybody that, look, this is the situation. But in my mind, it was like, in 10 days' time, I'm going to go back to work. But over the next couple of days, I became progressively, I got progressively, had progressive shortness of breath. The tiredness continued. Then I started experiencing muscle pain, like severe muscle pain, where, at times when I tried to get dressed, it would be painful for clothing to touch my skin. Appetite, I had poor appetite, but the most important symptom for me was the shortness of breath and the tiredness. And I was quarantining, and two friends of mine had tested positive at the same time as I did. They are also doctors. And so what we decided is that so that we can take care of each other, because obviously no one else can come in and cook for us and, basically take care of us because of the COVID situation, that we would quarantine together so that we can all take care of each other. And also because they had children and, they didn't want to expose their children to the COVID. So they moved in with me basically. And so the one night I was, I had been walking to my room and I was breathing so badly. And one of them said to me, what, let's just check your saturation. And we checked the saturation and found that my saturation was 65%.
What? 65%? Now,
Yes.
can you just explain to the people what that means? When your oxygen saturation is at 65%, where should it be normally? And, at 65%, what it means?
Okay, so your oxygen saturation, we say the lowest that it can be is 92%. In fact, my friend who's a pulmonologist is going to be very upset with me because they want 94% actually.
Yeah.
So for mine to be at 65% means that there wasn't a lot of oxygen circulating in my body.
Yes. So already at that point, I mean, that was like a red flag,
Immediately, and to show you what a red flag it was, we didn't even speak to each other. We just looked at each other and I just started packing. We never said any words to each other because we both knew what this meant. And I just packed a few things in a bag and we went to the hospital.
Right.
And,
and then, whilst you were in ER, you actually collapsed there.
Yes, the last thing I remember was chatting to the ER doctors, and when the next thing I remember is waking up in ICU.
Now, you woke up in ICU after how long?
At the time, I didn't know. I thought it was the day after, but I woke up in ICU, and now I'm told that it's almost
2.5 weeks.
Yes, almost 3 weeks since I'd been admitted to ICU, and that was a shock for me. Because in my mind, I had been admitted the day before. And now I'm waking up and I've got a tube that's running down into my throat and I'm breathing through this tube. And I'm like, what is going on? Why am I on a ventilator?
And then they told you that there was a lot of drama that took place in that 2.5 weeks that you were in coma.
Yes.
Tell us a little bit about that drama that they told you that you went through.
Yeah, a lot of things. So my kidneys failed. My lung had been punctured accidentally, so I had lung collapse, which means that I had a drain. My blood pressure had dropped so low that I was on what we call inotropic support, where they were basically supporting my heart, to keep my heart beating, basically to try and keep me alive. Like I said, my kidneys had failed, and then once my blood pressure had started picking up, then it shot through the roof, and now the fear was, now you're gonna have a stroke. The next thing you're gonna have a stroke, and then when they did a scan of my lungs, we found that I had pulmonary emboli, which is blood clots, which was also another risk factor for me getting a stroke.
Yeah,
Yes.
Yeah.
Yes.
So basically, whilst you were chilling in coma, not really chilling, but yeah, whilst you were in coma, stuff was happening. What we call, what do they call it now? A cytokine storm was busy in your body, causing a lot of trouble in different parts of your body. Yeah, with clots in the lungs, and there was also something about diabetes.
Yes, I developed diabetes while I was there. And once, like I said, then I developed high blood pressure as well.
So basically, anything that could go wrong
went wrong.
Yes. On somebody who did not have any health challenges prior to contracting COVID-19. Well, I mean, contracting SARS-CoV-2 germ, which causes COVID-19. Yes. So, and your own assessment was that you were low risk. That was before. And there you were actually collapsing in ER, staying for 2.5 weeks in coma, and waking up, and you are being told that you were full of drama, whilst you were actually, in coma.
Yes.
Right? What did you think of all of that as you were told that kind of information?
I was confused. I was very confused because it just didn't seem like it was real. It almost felt like I was in a movie and they were talking about somebody else. And I remember the cardiothoracic surgeon sitting on my bed and saying to me, is there anything that you're not telling us? Did you have any comorbidities whatsoever? And I said to him, no, I have no comorbidities. And I'm told they even asked, are you on any funny diet that we don't know about? And, no, I wasn't on any funny diet, so it was very confusing because I also couldn't reconcile what was going on and what I had been told with what I had known or what I had read about concerning COVID-19.
Yeah. All right. But anyway, at least good news was that you were awake. Those issues were dealt with whilst you were, in coma, and you were now at least, stable. Let me put it that way. You were stable. You were still in ICU, and then a physiotherapist came in to assess, those things that Ritabile was talking about. Just quickly, what is it that they found you could do or not do?
Okay, so when I woke up, I assumed that I could do everything. And when the physiotherapist came in and she asked me to sit up, that's when I realized that I couldn't even sit up by myself. So because, the hospital bed is electric, it goes, or, you can just press a button and you go up. So you don't realize that you yourself, your muscles can't keep you upright. And that's when, and once all the tubes had been removed and now I had to start eating, I realized holding a spoon is the most difficult thing at that point. Chewing is difficult. So all those things, they were able to, show me that, I needed help now with sitting. And I also realized that I cannot stand, I cannot walk, I cannot wash myself, I cannot dress myself. Basically, I cannot do anything.
Yes, you said something about when you were made to sit, you got so tired as if you had run a marathon.
Yes, I was sweating. You know, I was drenched in sweat. I was out of breath. You know, it did actually feel like I had run a marathon. I was out of breath. I was drenched in sweat. It was probably one of the most difficult things I've ever had to do, and that was just sit up, not do anything else except sit up.
At that point, when you realized these, deficits, what was going through your mind?
I was devastated. You know, I think at the time I became depressed. I was devastated, and the first thought was, I'll never be able to walk again. I'll never be able to do anything again. I'll never be able to walk. I'll never be able to work. You know, you don't see the light at the end of the tunnel at that point. All you see is my life is over.
Yeah. So at that point, you actually, had that thought that, you know what, the life that I knew as Nomthandazo, as a neurosurgeon, has come to an end.
It's over.
Yeah. All right. So you got discharged out of ICU, and you were part of you were put in a multidisciplinary rehab team that had an OT, the 2 OTs, physios, a speech therapist, and a psychologist. All right. The role of each one of these guys,
okay,
in your rehab.
In my rehab. So the occupational therapist, the first occupational therapist, her role was obviously she had to assess my work, the type of work I do and how to prepare me for going back to work. So making sure that I'm able to do my job once I'm discharged. The second occupational therapist, she does very similar to the other one, but she was going to do driving, those types of things, to assess those types of things. Then I had a speech therapist whose sole duty was just to make sure that my cognitive function is intact. Then I had a physiotherapist who obviously worked with the muscles to make sure endurance, I'm able to stand in theater, etc. And then I had the psychologist, because I cannot describe to you how difficult it is to find yourself with a severe illness, to find yourself in ICU, and to realize that you cannot do the things that you've always taken for granted. So the psychological impact was tremendous, and the psychologist was important to help deal with the mental impact as well.
And you were also angry that you got in for something that should have been mild, and there you are basically not able to do anything.
Yes, there's anger, there's the why me, why is this happening to me, and the anger of, this might sound selfish, but you're wondering why, it's the anger is part of the why me, that here I am, everybody else has been able to just have mild symptoms, but I'm the one that's lying in ICU. Why am I the one that's lying in ICU? What is it about me that made me get, the severe disease?
Especially because you didn't have any comorbid disorders.
Yes, exactly. So yes, the anger was the blaming myself, because then, I would think and try to pinpoint, what is it that I could have done differently? Why did I get this? Was it my fault? So you go through all of those emotions.
All right. So can I just take a few minutes, just get to Retabile, just come back quickly. Ms. Matolweni, just quickly, when you hear what, the state that she was in as she was being discharged from the ICU the first time around, quickly, what goes through your head? Quickly, I don't want you to give us a long lecture now.
In fact, when she was still in ICU, because Nomthandazo is a friend of ours, reports were coming in to say that now the kidneys are failing, this is happening, blood pressure too low, now it's shooting up. And for me, all I was concerned about was that what would be the functional implications of what I'm currently, the information I'm currently getting, what is going to happen, because you have this person who is performing a high cognitive, highly skilled job, and you're getting this history that now this is what is going on. And at some moment, I was worried about the stroke when we were told that now there's embolize and the blood pressure is shooting and so on and so forth. So you have this, sorry, my friend, I'm going to call you a patient. You have this patient that has had so much drama. And the most important thing as a therapist is that you start from the basic and say, what has caused this? What functional capacity do we still have? What do we build on it? And you basically take each day as it comes. So if Nomthandazo, for instance, is still in ICU, what kind or what type of rehabilitation can you give at that level? And how then do you match that with the person that she is, right? So you're almost appreciating the fact that there's an issue of beds, either in private or public hospital. It's the same thing. This person may be discharged as soon as the vitals are normal. So you literally don't have time at your disposal. But I think the most important thing, without feeling overwhelmed, is that you'll be so much amazed that when you actually do what you call a functional capacity assessment, you've got a lot of baseline to work from. Nomthandazo, for instance, she sent me a message, that WhatsApp that I tell you about, that I'm worried about my hand. Now, reading that WhatsApp, it was coherent. She was orientated to everything. That was fine. So I'm like, okay, fine. The problem is with the hand. Cognitively, we're there. Because had she sent me a WhatsApp that did not make sense, I was going to say, oh, now we've got bigger problems. So you'll be so amazed that you start from the beginning. You assess what you function, what you have, and then you take it from there. There are red flags, for instance, that if the neurological system has been so much affected, then you know that you could be having more problems in terms of restoring functional capacity. And yeah, so basically you start with what you have and then you take it from there.
Yeah, so she could not do anything. She couldn't lift up a spoon. She could not sit. She could not stand. Yes. She could not, do anything. I mean, now this is somebody who must at some point get back to be a neurosurgeon and operate on a delicate organ of the body called the brain.
Yes. Then again, you ask yourself, if someone is sitting on a chair and you say stand up and then they cannot stand, there could be 5 or 10 reasons why they are not standing up, and you stratify those according to risks. So she could have had a weak muscle because she was in ICU. It was a prolonged case of hospitalization. She could have God forbid, fractured a bone. It could have been in the brain. So the fact that she could not lift anything, what one needed to understand is that what caused it. And then once you understand what is causing her inability to even lift up the spoon, that's when then you will then tend to appreciate how much of a problem do I have. Because also don't underestimate that the human body has got a power of healing itself. You feed it, you give it medication, 3-4 days, strength is regained in the muscle, and a person can walk, and then the person can feed. I mean, so that assessment is very critical to say what caused the inability to even lift a hand or feed herself.
Lovely. Let me get back to Doc. So, Doc, you came out of ICU. You are now, in a rehab facility nearby the hospital. Or next to where you were admitted, and you had all of these people working on you, and you made good progress. In fact, you told your physio that I want to get out of this place walking. You were so determined that I want to be out of here, not assisted, but walking on my own, right? What made you to have so much determination and put that goal, which looked very far from where you were?
Perhaps it's that stubbornness that you spoke about, and the fact that I had seen patients, obviously, in my own clinical practice, I had seen patients with strokes, etc., undergoing rehab and getting very good results. But more often, but more than that, my thing was, I'm not going to let this get the better of me. If there's something that can be done, it will be done. And I have the resources to do it. Therefore, I'm going to push as hard as I can. I'm going to take this as far as I can. And this is not the time to give up, especially once I found out what had happened in ICU and everything that I had gone through since waking up in ICU. My mind said to me that, look, you've gone through so much. Now you just need to push a little bit more to get back to where we need to be.
Yeah. But how difficult was it to motivate yourself when you were dealing with the anger issues we've already spoken about, and you woke up and found that there was something that happened, in your mouth, so you were not able to smile. You had anxieties, about many things. So at a mental, emotional level, it sounds like there was a turmoil.
A huge turmoil. I think it was a daily thing. It was a daily, I had to take it one day at a time. Every day I had to wake up and, re-talk to myself, if there's a word like that, have a conversation with myself every single day that I'm gonna wake up today and this is what I'm going to do. But I also think nothing, and I always say this, nothing beats having a very good support system. And I was always aware that, my parents have been through so much, my family has been through so much. Now it's my turn, to push.
Because when you were born, your mom went into kidney failure.
Yes,
that exactly. Is your first day here on earth. Yes. That's why you were actually called Nomthandazo.
Yes.
Because your mom went into renal failure when you were born. So she overcame that, and now this was your turn to go through a serious, life-threatening challenge.
Absolutely. And, I didn't have the option of not pushing through. After everybody has been rallying around you, all the phone calls I had received, the messages, everybody praying, everybody sending me, messages, etc. And I didn't really have the option. In my mind, there was never an option of, now I'm just going to sit back and let myself not be functional. I then had to push forward and bring myself to a state where I could get as close as possible to where I was before I was admitted.
Yeah. But then, COVID was not done with you.
Yes.
At that point, you were making good progress rehab-wise. And then all of a sudden, you had another setback. You started coughing. They did an X-ray on you, and they found that you've got what we call empyema, and they also found that you had hematoma of the liver. Just tell the viewers who don't understand medicine what those two things meant.
So to put it as basic as possible, they found that there was pus in my right lung, and also that basically my liver had been bleeding. And so I had to go back to ICU. And at the time, the idea was you're going to go back to ICU for 24 to 48 hours, because you're going to go to theater, we'll drain the pus, we'll drain the blood, you'll be in ICU, and then 3 days, you'll be fine. We'll take you off the ventilator and you'll go back to rehab and continue. And I was quite happy, went back to ICU, woke up a week later.
Yes. All right. Yes. So basically, you were in ICU for the second time. Yes. In your admission period.
Yes.
And you were, would I call you, were you in coma? Because there's a week you can't account for, Yes. What was the reason? What did they tell you was the reason for you to stay for that period? When you had gone in for a procedure that was meant to, just be like, a day or two in ICU.
I don't think we're completely sure. I just didn't wake up, or let me put it this way, it took a little bit longer for me to wake up than was expected. And I remember joking to my friends, because, you know, then I was quiet for another week and everybody completely panicked. You know, now you are awake, you were talking to us, and now it's silence again. What just happened? And I remember joking to them and saying, no, my body just wanted to nap. You know, my body just wanted to rest a bit. So that's why it took a little bit longer to wake up. It just needed to rest again.
Yeah, so that's another week of you in ICU. Yeah, and then you eventually came out of that, continued with your rehab, you made progress, and then you were able to be discharged, walking, which is the goal that you had set for yourself. Walking, unassisted, obviously going through all the stages of, you know, walking ring, you know, double crutches, one crutch, and all of that, you know. Right, so you were able to come out to continue rehab as an outpatient. Lovely. Okay, so but at that point you still were not in a state that you could even drive or even care for yourself, to an extent that your parents wanted to stay with you, but the compromise was you must move in with your sister. You know, and you moved in with your sister. So when you had the interview with us in December, you were still with your sister. You're still with your sister?
No,
or now you are back to your own place?
I'm back to my own place.
Right. So, Doc, let's just reflect now. This experience or this ordeal, you know, I mean, you went into hospital on the 28th of July. You came out sometime in October.
Yes.
Right? Almost like 3 months later.
Yes.
Yeah. When you now reflect, I'm talking about now, reflect on that ordeal, what, you know, what insights, you know, what are the thoughts, you know, that you're going through? Because remember, I said this interview was really about reflection, but for the benefit of people who didn't watch the last one, you know, we had to go through some of the stuff. But when you are reflecting now, you know, I mean, a few weeks ago, you took the COVID-19 vaccine, right? Right?
Yes.
So
Yes.
as you were taking that vaccine, and also just reflecting on everything from the time you collapsed at ER to now, you know, what are the things that are going through your mind? What insights, you know, it's supposed to be a life-changing experience. So what has changed?
It's a completely life-changing experience. You know, I no longer take anything for granted, for one. For me, every day, every experience, every moment is precious since that time. It's also, you know, before, like I was saying, before I was admitted, I was working, you know, I was working myself to a standstill. I was running around. I wasn't, you know, there was a point where I realized that I hadn't been taking breaks, you know, to taking care of myself, you know, just sit and watch TV, for example. I wasn't doing things like that. I wasn't reading as much as I wanted to be reading. So, you know, it also taught me that I needed to slow down. You know, it almost feels like I was forced to slow down, you know, by the illness. So things like that, where now I'm more conscious of, if I'm tired, rest, you know, if you know, I'm trying not to pile a lot onto my plate. But it's also, I think it's also changed the way we live, you know, the way we interact with other people. We are not as social as we used to be, you know, and we've had to live with that. We've had to adapt to that. We've had to adapt to showing love to people in a different way. We can't hug people anymore. You know, you can't kiss people anymore, for example, you know.
Yes,
so
yes.
We've had to find new ways. We've had to use our words now more than ever, because we cannot show affection in the way that we used to show affection. You know, the way that we live, the way that we work has become very different. You know, I always say that COVID is a very isolating and a very antisocial disease. And we've had to learn to overcome that antisocial part of it, to adapt our lives to it. I've also learned that I need to, like I said, need to do the best for myself. And that's why I took the vaccine. For me, it was never an if, it was always, I will take the vaccine. I just waited for it to be available. But I always knew, because in my mind, it was always, I need to protect myself the best way that I can, because COVID has shown me that I'm not invincible, you know, that I'm not above getting ill, and I'm not above dying. So it's taught me that I'm very, very human, you know. It doesn't matter what job you do, it doesn't matter what your status is in life. COVID has shown that we are all human, and we can all die. Yes.
Yeah, and I mean, you had many near-death experiences during that 3 months in hospital. I mean, to have so many complications happening around about the same time. You know, I joked last time and I said, Gabriel, you know, who is normally very enthusiastic to come and fetch people to go back, he tried many a times to come and fetch you, and somehow you were like, no, I am uneasy, you know.
I think the Dubes were standing there like, not this one.
Not this one. We are not done. Her mission here on earth has just started. You cannot take it. And also, I mean, you are going to take from a profession where there's still so few of Black female neurosurgeons. You come and take this prized asset. No, it's not going to happen, you know. But when you think about those near-death experiences, you know, now, obviously, now you are back, we are okay. You mentioned something about gratitude last time.
Gratitude is probably the foremost thought in my mind at all times. I still keep a gratitude journal that I write 3 things that I'm grateful for every single day. And you'll be surprised at the things that you overlook. We overlook the little things, you know, grateful for water coming out of the tap, you know. So for me, my life now is all about gratitude. I'm always just grateful for waking up every day. And you know, I think I think it was either last month or the month before, they took out a list of the healthcare workers that had died, you know, over the past year. And I looked at that list, and I remember it brought tears to my eyes, because I looked at it and I thought my name would have been on there. Yeah. So, you know, that for me, the realization every time I see someone that has died of COVID, that's where I might have ended up, you know, always reminds me to be grateful.
Okay. And, you know, do you go to the malls nowadays? You know, do you go to places where there are people? You know, are there things that you are very afraid of doing now that you never even thought twice about them? You know, when Ritabile invites you maybe to some drinks thingy, you know, do you think twice of going to check what's new at the Maxhosa shop? You know?
It took a while for me to, you know, to go out socially. Malls, I still struggle to go to malls. I have anxiety about being in malls, especially, you know, if I walk into a supermarket and I see, you know, that it's very full, long queues, then I'll do without that bread for the day. You know, I'll come back either later or on another day. So it's, you know, I still have a bit of anxiety. And I think the anxiety is not even about the mall. It's more about the behavior of people. Because if I'm in a mall and we're still keeping the social distancing and everybody has a mask on and, you know, the sanitizing and all of that, then I'm sort of more comfortable. But, you know, I've been in situations where, I'm standing in a queue and someone comes and stands directly, you know, behind me. And I'll turn and I'll say, you know, would you mind stepping back? Some people don't want you to say that to them. And in cases like that, I leave. You know, I immediately walk away because I don't want to get into a confrontation. And also I have to protect myself. But the other thing that I do as well is when I visit people, I keep my mask on more often than not. Even if other people don't have a mask on, I will keep mine on. And if I do go to a restaurant, I insist that it must be one that has an outdoor space.
Yeah.
Yeah, so that it's well ventilated.
Yeah. Okay. So, but you had an experience, I think a few days ago, about
Yes.
somebody who, just did not understand why they have to take the non-pharmaceutical measures.
Absolutely. I met somebody. We happened to be at dinner. A very small dinner, and I then requested that, guys, in light of what's happening with COVID, can we please all sanitize our hands? We had actually placed sanitizer on the table, and
Yeah.
he said no, he's not going to sanitize his hand. And then I said to him, if you say you're not going to sanitize your hands, then
Yeah.
please go and wash your hands. The bathroom is just close by. And he said, no, he's not gonna, he doesn't see the reason why you should go and wash his hands. And he doesn't take instructions from other people. And
Yeah.
I just thought to myself, it's been a year of the pandemic and you are refusing to do the basics. And then he then said to me, I know that I will never die of COVID-19. And I thought, wow, okay, I will leave you with that thought. I can't change the mind of a grown man.
Yes.
If he feels that he's invincible enough to beat COVID-19, should he contract COVID-19, that's on him. But that's when I realized that what I can do is protect myself from him, because
Yeah.
he does not want to protect the rest of us from himself.
Yeah. All right. So, Doc, obviously, you must have also thought about, how are you going to do things differently as a doctor,
Yes.
as a neurosurgeon? You shared something about whilst you were in coma, and people thought you were in coma, but you were coming in and out, and sometimes you could hear comments from the doctors or nurses, and that taught you something that you wanted to share with your colleagues once you are back at work. Can you just share a little bit about that?
Yes, so like you were saying, I was drifting in and out of coma, and I heard two people. I don't know if whether they were nurses or doctors, but they said she's not gonna make it. She's not gonna make it till the morning. She's gonna get tired, and and as I was lying there, I thought, who are they to tell me that that I'm, because basically they're saying I'm gonna die, and then I thought, I'm going to show them. I am going to make it till morning. I will make it until tomorrow morning. And what that made me realize is that sometimes we think patients are in a coma, they can't hear what we're saying. And it's insensitive to be saying things like that over somebody who is fighting for their lives. I mean, for what could have happened is that I could have given up and, believed that I wouldn't have made it till morning and given up fighting. And so what it said to me is that it's important for us to watch our words at any given time. We mustn't assume that the person is in such a deep coma that they cannot hear you. And what the whole experience has taught me, and I used to say to the staff in ICU, is that the experience has changed the way I practice medicine. I'm very empathetic because now I know exactly how the patient feels. I've had every single thing that could be almost every single thing that could be done to a patient in ICU done to me. I know what an arterial line feels like. I mean, I had a tracheostomy. I had a tube that I was breathing out of from my neck. I know how it feels to have that tube suctioned. I know how it feels to have a central line put in. I know how, so I know exactly how it feels to be an ICU patient at this point. So it's made me a little bit more empathetic than maybe I was before I became a patient. So that absolutely changes the way I practice medicine. But of course, the other thing is we are a little bit more vigilant now as healthcare workers. We more closed off in a way, because obviously now we're coming in with shields, with the mask, And more often than not, you don't get to see the face of the person that's taking care of you, because they're protecting themselves and they're protecting you. So those are the little different ways in which we now practice medicine.
Yes, the isolation of being there and people can't visit you. How is it? How does it affect you as a patient fighting for your life?
It adds to the trauma, and it also adds to the almost helplessness, and also slipping into depression is quite easy at that point, because your support structure is not there.
Yes.
Which is why it was very important, and it helped me a lot, the fact that I could video call with my family. They could video call and give me the words of encouragement, and all of that. And I suppose the difference with me as a patient is that I sort of knew the doctors, in ICU. So I wasn't completely isolated. So I could still see some familiar faces. So that helped a lot. But but that made me realize that a patient who doesn't see a familiar face, we cannot blame that person for slipping into depression and for becoming hopeless, because it is such an isolating environment.
Yes. All right. And then you come out, you start to read news about PPE, corruption, the fact that possibly there could have been substandard PPEs given to frontline healthcare workers. What does that do to you, having gone through something like that? And it's a possibility.
For a long time after I was discharged, I stopped listening to the news because I would get angry. I would get so angry because, like you're saying, was it because the PPE I was using was substandard? Is that why I ended up almost dying? Is that why my colleagues are dying? Is that why my relatives are dying? So, such things really still make me angry, because I just feel like that's disregard for human life. It's like the other day, I read a story that they found counterfeit vaccine in China and in Germiston. And, my first thought was, why would you make a counterfeit vaccine, for we're in the middle of a pandemic, people are dying. That just simply says to me that you have little or no regard for human life.
Yeah, yeah. All right, Doc. So the vaccine, you took the vaccine. Again, sometimes here in South Africa, we take, 2 steps forward and take 1 step back, and we are so much into conspiracy theories and all of that. Obviously, there was a reason for the AstraZeneca vaccine, to be put, to be suspended. I'll put it that way, because of the data that had come out, putting question marks on effectiveness for mild and moderate disease, even though it had not been tested for severe disease and death. But it was enough to make people scared that it may not work, for our local, I'll say the dominant variant. And so we had to find a quick solution as a country on how to make sure that we had planned to have the vaccine on the 1st of February being, rolled out for healthcare workers. Now the vaccine we've procured cannot be used. We had to find, new ways of how to still get a vaccine to the shoulders of the healthcare workers under any other, legal means, within SAPRA. And so MRC came, and they felt, okay, if they do a study, an extension, of a phase 3, they call it phase 3B, that could happen under the guidance of South African Medical Research Council. And, 2 days after the date that was set, we started having people getting jabs, obviously under, trial conditions, because the J&J vaccine had not yet been, approved by SAPRA. Even FDA had not yet approved, but the vaccine itself was proven to be effective and safe. Now, for you, well, some healthcare workers still chose not to take the vaccine. What were your considerations around that?
For me, there was never a doubt. I've been very vocal about the fact that I would take the vaccine. And like I said, for me, it was always, I need to have the best protection for myself and for people around me. So it was never, there was never a doubt. There was never, I was always going to take the vaccine.
Yeah. So the issue of why Sisonke trial, and wara was not an issue for you
No,
because the vaccine had been proven to work.
I was happy.
Yes. All right. And when you ultimately had that vaccine, on your shoulder,
Yes.
what happened? Your thoughts?
I was very excited.
Yeah.
When I got the voucher, because they send you a voucher that say, with the voucher number that you need to present at the vaccine center. I was very excited. I mean, I left, drove there, and when took a picture. We all take
Yes.
pictures when we get the jab. And for me, it was okay. I'm doing the best that I can do, and I hope that other people will take it. And there was the little thought of, what if I get side effects? What's going to happen? But
Yeah.
I was willing to deal with the side effects.
Yeah.
For me, it was nothing but excitement.
Yes. And any side effects, that you experience worth talking about?
No, like I was tired
Yeah.
that day, but I'd had a very long day. So
Yeah.
I don't know if it was a vaccine or if it was a long day. But other
Yeah.
than that, I had no side effects whatsoever. I kept waiting, like I said, and I'm like, okay, anytime now, I'm gonna have a side effect, and nothing happened.
Yeah. All right. Okay. So basically, you are encouraging people to positively consider vaccination. Am I right?
Yes,
It's voluntary. It's voluntary, but
yes, that's exactly what I was gonna say. That there's so much conspiracy theories. I had people send me YouTube clips and all types of things about how COVID doesn't exist. And all these other 5G and all those other conspiracy theories.
mm,
Well, I personally, I think the vaccine is a good thing. I think anyone out there who's willing should go for it. Yes, some people do experience side effects, but it's a medication.
yeah,
And even the vaccines that we were given as babies, sometimes babies will react to them, or the flu vaccine, sometimes people will react to the flu vaccine.
yeah,
So we always expected side effects.
yes,
Some people react to a paracetamol, a Panado,
yes,
they'll react to it. So yes, there was always going to be side effects. I know people are talking about it was rushed. How do we know that it's safe? We wouldn't be given the vaccine if it was not safe,
yeah,
So, for me, I would encourage people to take it, but of course, it's voluntary. If you don't believe that you need the vaccine, or if you believe that you don't want to take it, it is your right. No one can force you.
yeah,
And it should be an individual decision.
yeah.
I mustn't be the reason that you take it. You must take it because you want to take it.
Right, beautiful. Now, Doc, there's just a few comments from people who were watching.
Okay.
Just to give your vocal cords a break.
Okay.
So I'm going to ask my colleague, Nwami Santlama, to just read a few of the comments quickly so that we can, work towards wrapping up. And what we'll be talking about now is, South Africa's response to this. And, do you see a light at the end of the tunnel in terms of turning the tide? In South Africa, 101,000 healthcare workers as at last night have been vaccinated. No one has died. No one has had major issues. Yes, there was a nurse in Northwest who had some allergic reaction, had to attend to that person. But within 24 hours, they were out of any serious situation. So no one has died. All right, no one has had any major situation. So for me, that's 100,000 people. Okay, on a vaccine that had gone through all the phases. But I want you to just, your closing remarks from a national and global point of view. But Nwabisa, can you quickly read the comments, please?
Okay, Doc. The first one is from Yvonne. She says, said no one gets to know their oxygen saturation level until it becomes low. And then Abinatu says, what an uplifting session. Also, Digeleti says, quite an inspiration. Wow. And then Yvonne wrote again, you are an overcomer. God blessed you with such a positive personality. And Mameno wrote, it can only be God. His grace is sufficient. You are a living testimony. And Winzulu wrote, wow, what a story of survival and love. And like Ella also wrote, what an amazing story of survival against all odds.
Yes.
And all right, Kanyisile wrote also, your story and courage is inspiring.
Okay,
she wrote, so unethical.
So says some people are just ignorant. All right, I think it is the experience you had a few days ago about somebody who didn't want to sanitize. Yeah, but Maneno Pataki.
Maneno says are very insensitive for healthcare workers to sentence patients to death. God is the one giving people life. All right.
Can you see
also, Kanyisile, I did read that one. You wrote, your story and courage is inspiring. And Sbo wrote, to God be the glory.
Yeah, all right.
Yes, those
are there any other comments?
No.
Okay, all right.
Thank
you very much. Thank you very much. So, Doc, people are feeling your story. They feel it's a story of triumph of human spirit over adversity. I'm sure you agree with them. It took a lot before this ordeal. Your biggest fight was to get to become a neurosurgeon with all the hurdles that were placed, in front of you, and you managed to jump over all of them and you succeeded. But then it seems like that experience, patriarchy and all these other things, was actually preparing you for a much bigger fight, a fight for your life.
Yes, it definitely feels that way, that I had to go through what I had, what I went through in order to prepare me for this.
Yeah, beautiful. Now, Doc, at a national level and at a global level, just your insights about pandemics or this particular pandemic. Just your thoughts around that, the fact that life has come to a standstill and life will never be the same as we knew it. Any spiritual take in it, and I'm not saying religious. I know, spiritual take. I know. I didn't say religious. I got you once again.
Yes, you did.
The universe, the higher power.
Power. Yes. So I think what the pandemic taught us is that our healthcare systems were not ready, and it also showed us that for most part our healthcare systems were inadequate. I think that's the biggest realization, that most countries, including first world countries, who we always thought had a better healthcare system than us, I think it proved to all of us that we were just not ready, and taught us that we perhaps need to turn it up a bit,
Yes.
be better prepared for any future pandemic. And I think that's what it's preparing us for. Should we have any other pandemic, we've had a practice run, if you can, if I can put it that way. So it's preparing us because, when you think of us here at home, when the pandemic started, that's when we realized that, we actually don't have enough ventilators. We don't have enough ICU beds, etc. You know, these were things that had not been considered before the pandemic. And now it was, you know, a big rush to try and get everything up to par. It's obviously, you know, like, you know, change the way that we do everything, change the way that we practice medicine, we interact with each other, etc. It's going to change the way we travel, for example, because, you know, there's countries that are considering a vaccine passport where you're not going to be allowed into the country without being vaccinated. And that's probably also, you know, something for everybody to think about if you are going to be traveling, that you might actually encounter things like that. I don't know if that's a good or a bad thing. You know, I'm not a politician, so, you know, it's just something that I've read. And, you know, I'm also not a virologist, so I took the vaccine voluntarily. It was my choice. I can only give the information that I have from where I am. In terms of healthcare in South Africa, we are obviously practicing it differently. We have challenges, but I'm hoping that we'll be able to overcome the challenges. I must say, when I went to get the vaccine, I was very encouraged by, you know, the vaccination center. It was very, yes, it takes a long time to get through the queue and to eventually get the jab, you know, and all of that. But it was very, it was well organized. You know, it was well thought of. It was, the layout was good. You know, so I was quite happy. You know, I was very encouraged by it. But you can also see from looking at the vaccine centers that we've got now, that trying to replicate it is going to be hard work. You know, it's going to take a lot of resources. It's going to be a lot of hard work. But I think the start looks good. You know, at least where I vaccinated, it was looking very good. I mean, first world countries, the US was having huge problems trying to vaccinate. You know, first world countries are struggling to vaccinate their citizens. And then when you think of us not being a first world country, still being able to vaccinate 100,000 healthcare workers, that in itself is, you know, it's an achievement. It's a small achievement, but it's an achievement nonetheless. It means
it is an achievement. I mean, we have, by the 5th of this month, South Africa was the leading number one in terms of vaccine numbers at about 100,000. You know, so that is good. You know, the next country was around 85,000, and the other one was around 62,000, which was Senegal. I just had forgotten Seychelles was number 2.
Seychelles,
you know? Yeah. So even with our difficulties, you know, and we are ahead of countries like New Zealand, you know, countries like Australia, countries like Malaysia, you know. So sometimes when we look at our problems, we need to have a global perspective, because at times when we just look within, we just think we are the worst country in the world, you know. So actually, yes, we could have been far, but at the same time, the issue about the AstraZeneca thing could not have been predicted. And we're now using, you know, a different vaccine under a different regime that has to be supervised, you know, which actually the upside is that it gives us experience on how to do things, so that when we do mass vaccination, things can be done even better, you know.
Exactly. Yes. So yes, so we're getting valuable lessons at the moment, you know, from the rollout as it is, and you know, we learn every day. That's all we can do.
Yes. Yeah. All right, Doc. Any closing remarks? I think you are tired by now. You've been talking. I've been training those vocal cords of yours as part of your rehab.
Yes. You know, I'm closing remark. You know, I'm just grateful. You know, I never would have gotten to where I am without the help of everybody around me, healthcare workers, you know, family, friends, etc. You know, I'm happy to say I'm back at work. I'm functioning.
You are able to hold that scalpel nicely. No funny things.
No, nothing. They put in a lot of work and they made sure that I was able to go back to work. I'm back teaching, running around the hospital, etc. So I'm entirely grateful. My story had a happy ending. I know that a lot of people didn't have a happy ending, and we keep those people in our thoughts. We wish them comfort, and I hope that I can at least offer some kind of hope,
You have already.
Yeah, to people that, because part of the thing that's happened with this whole experience is that I've sort of become a little bit of a counselor. When somebody gets a diagnosis of COVID, immediately they phone me. They're like, I've just been diagnosed with COVID. What must I do? So, a lot of the time I'm playing that role of calming people down, do this, don't do this, etc. So it's changed my life for the better, if I can put it that way. Yes, I still, I went through quite a lot and obviously had a lot of challenges, but I think I came out of it quite well.
So the setback, health-wise, has become your comeback, and it has redefined, how you see the world going forward, and it has made you more determined to make a difference to humanity.
Absolutely, absolutely.
Yes. All right. Ritabile, do you have any closing remarks to your friend, the brain surgeon, Dr. Nomthandazo Amanda Dube? They call her Dr. Ginger. They call her Kick-Ass neurosurgeon. I'm also going to give her name now. The name I'm going to give her is Umafe Vuka.
What I had, in fact,
the one who dies and wakes up, Yes, closing remarks, man.
Nomthandazo is a friend, so as much as the ordeal was like, it was also personal. So I'm amazed by her resilience, and a passion of neurosurgery, wanting to go back and overcoming everything else. And it's true, because what she's saying, that even a small COVID scare, I remember I was also waiting for my results. The first person I ran to was her, and she was able to calm me down. So yes, Kumafe Vuka, good I had, and she's an amazing person. No, she's not dying. This one is not dying anytime soon. And thank you, Tats. She's something else. We're waiting for a book, Dr. Nyati, and it's.
Yes, pressure. Remember we attended the webinar where we invited Dr. Patladira, to talk about the neuro psychiatric manifestations post-COVID, quite scary stuff, So you guys, please give a space to rehabilitate cognitive. Was to write a book, you really need, all your faculties, and we.
You don't know this one, Dr. Nyat. She's ready this one, I can tell you. Okay. Thank you so much, Doc. Always a pleasure coming to your show. Thanks.
Lovely.
Thank you.
All right, Mambuyas, thank you very much for honoring us once again. Your story is a story that so many people need to hear, because you overcame all the odds, just like what Sisla Kela Kaunda has said on the comments. You have overcome the odds. Everything that could be thrown at a person, you dealt with it, even when you were actually, in coma. So really keep that strength, keep that fighting spirit, and may you continue, to add value to other people's lives, starting with the medical students, with your registrars, and with all of your patients. Show them that, it's possible to fight and win, and you have done that, and you are a good example of somebody who's got what we call inner resilience. So thank you very much, Doc.
Thank you so much.
All right, thank you. I want to thank all our viewers. We took a little bit long, but it's difficult to keep it within an hour when you've got an uplifting story like this one. But I want to thank you for joining us and just, drinking from that positive cup. We all need positivity at this point. And Dr. Dube has just filled our cups with some positivity. But may she also be aware that her cup must not run dry. From time to time, she needs to also refill her own cup as she now has a new role as a counselor. Thank you very much to everybody. Till next time. Thank you.